first it was really the insanity of doing something that clearly hasn't worked and couldn't work. As time got on, I became more concerned by the fact that not only what we're doing didn't work, but it was also unfair and unjust. It's almost worse to do something that you know is unfair and unjust. It clearly is very discriminatory. It takes away the human rights of a very vulnerable group of people. And over time, I came to realize that the worst thing about drug prohibition is the damage it does to people living in countries where drugs are produced or transited. They are the people who pay the highest price for this global policy of drug prohibition. There are a whole series of events which have been very important at the time. And what's really involved is that this is a process. It's not an event. It's not like the Berlin Wall collapsing and communism disappearing. This is a slow, insidious process, a bit like gay law reform, or a bit like the more equal treatment of women. There have been some milestones, some highlights, but it's steady pressure. It's the winning of one argument after another. It's governments and major leaders in the world conceding that what we do doesn't work. And along the way, along that 30-year journey, there have been a whole succession of conferences, of announcements, of press conferences, of publications, of new programs, new organisations in Australia, around the world, that have indicated that whatever the new policy is going to be in the future, it's not going to be drug prohibition, it'll be something else. And the critical parts in that will be changing the emphasis from criminal justice to health and social measures, and also starting to regulate as much of the drug market as we can instead of leaving the regulation of the drug market to criminals. What I've learned professionally is the importance of evidence. When I was a young medical graduate, I of course believed in science and evidence. I sort of believed it in my head, but I didn't really believe it in my heart. When I got really involved in harm reduction and drug law reform, I realised that evidence and values were the only things that separated us from the barbarians. And of the two, they're both very important, but evidence is probably even more important than values. And I saw again and again how people adopted crummy processes to try and stop evidence counting. When they knew the evidence was against them, they did all sorts of cover-ups to stop people realising what the evidence showed. And I saw that again and again and again, and I just saw that the evidence, even though it often takes a long time, the evidence eventually wins out. I've come to realise also the limits of logic and rationality. In this and many other debates, logic and rationality is important, but it's not the be-all and end-all, because a lot of people think emotionally. That is, they've got small kids, they're very fearful about their small kids, rightly so, and they're not all that interested in any evidence. And if some demagogue gets up and says, vote for me and I'll stop all the drugs entering the 27,000 kilometre coastline of Australia at midnight tonight, they'll swallow that nonsense and vote for that person. That still happens, but eventually even those people will change their mind when there's just so much evidence. Well, I'm sorry to say that I think the most important health challenge facing the planet now is climate change, and I think the evidence has been growing for a long, long time. Maggie Thatcher, when she was Prime Minister of Britain, the first British Prime Minister who was a scientist for over 100 years, Maggie Thatcher believed in that global warming was, climate change was a real phenomenon. But when you go back even further, it's the idea is over 150 years old, the evidence is overwhelming, and I think we're in the very early phase of this now, and it's not going to affect me. It's only going to affect my kids in the later stages of their lives. But I've got 2 grandkids, and I really worry about them, and of course I worry about everyone else's grandkids. It's very scary, and I think we will rue the day that our politicians ignored the evidence, pretended that the earth was flat, pretended that the sun rotates around the earth, and pretended that the global warming evidence isn't there. Of course it's there, and we should be doing something about it, and the health effects are going to be catastrophic, no doubt about it.